We lost one of the dogs. I thought, oh, I'm going to get a couple of kittens, and then Jerry comes home with that. Oh,
good.
Boy.
And ear problems today?
No, she's got an eye also. Well, almost.
Claws, don't you?
Okay. I got
Hang on. So first thing, I bring him in. Just do a brief exam on him. Get a weight. Take a temperature and look them over. Look at their eyes and ears, mucous membranes. Listen to their heart and lungs. Feel their abdomen.
Oh, is it? Okay. And then
Abby, this is Abby. She's a pretty young cat. So we shouldn't, and she hasn't had any previous history of health problems, so we shouldn't have to worry about doing any blood work. Some clinics always do a pre-anesthetic workup. Kitty.
well, yeah, that's true.
We might need an extra hand to stretch her out. Excuse me a second. And we're going to give her a shot, too.
Okay.
You might have to grab the back legs, too.
Well, see ya. Have
Or
a
you
good
can
day.
grab the front. I'll grab the back legs.
Don't growl, kidders. Bite me or
Can you grab the tail, too, by chance?
I don't think I need her front paws.
Nope.
Okay, Abby.
Do we need to do anything else with Abby? She's up on all her vaccinations and things, I
I'll
think.
double check that. It was Catherine's cat that needed some vaccinations.
Okay. Hey,
We're almost there.
this is usually how we restrain a cat who's kind of squirmy or a little irate. We usually scruff the neck and grab the back legs and kind of stretch them out. Looks pretty gruesome, but it's really pretty humane.
Sit, boo-boo, sit.
Quiet and friends. Okay. Relax.
Why do you do that?
Pick up the skin.
Mm-hmm.
We check up and it would just stay there,
Oh, okay.
but it snaps back right away, which means she's well hydrated. When an animal comes in for surgery, we tell people to leave them off food or take them off food after 10 o'clock the night before, but still let them have water so that they don't get dehydrated. The reason we take them off food is that sometimes when they're under to vomit up whatever food is in their stomach, and sometimes they can aspirate it, it can go down in their lungs, which is bad. this muscle. Grab this rough with the other hand, and grab this back leg.
Okay.
And I'll try not to stick you.
Please.
We gave her a pre-med, which is kind of like a tranquilizer. We gave her a drug called butorphanol. It's kind of like morphine for pain and for sedation. And then we gave her some glycopyrrolate, which helps basically reduce a lot of glandular secretions when they're under anesthesia. They'll slobber a lot and stuff when they're under anesthesia, and that kind of helps reduce that. So we usually give her pre-med and let that take effect for 5 to 10, 15 minutes. That usually makes them a lot calmer before we actually give them the anesthetic that puts them out for the surgery.
About how long does the surgery generally take?
Well, depends on who's doing it. The more you do, the quicker you get. I can probably do a cat spay usually in half an hour. That's pretty slow by most clinic standards. A lot of veterinarians who do them all day, every day, will do it in 10 or 15 minutes. I think we're going to give him some fluids so that he can... I don't know, he didn't drink very much, did he, on his bone? Okay. We're going to give him some fluids and see. There's a little bit of water in there. I want to make sure he can definitely pee, though, before we can send him home. Stay here, bud. We're just going to give him fluids under the skin. Buddy? I think so. I usually give them about 50 mLs, 50 to 100 under the skin, just so that they get some fluids into them. And, then I'll check their bladder later on to see if their bladder's getting big. If it's getting really big and they're trying to urinate, I know that he's still blocked, and we'll probably have to catheterize him again, but hopefully he'll be able to pass some urine here.
You got it on here.
Yeah.
I'll see it up.
After hours office call and a brief exam, and then I sent him home with some cephalexin, 14 of the 250 milligram, and then I gave him they have to treat the skin. It's got a hot spot, and they won't let him touch it.
Oh, okay.
And then I gave it a beta-noctin shot, 0.25. Sometimes I use this little V tray I set them in just to get them sitting straight. I usually put towels down on the table because it's pretty cold. When they're under anesthesia, they can't regulate their body temperature quite as well, so they'll tend to get hypothermic, subnormal body temperature. It's not as big a deal in older animals or adults, but especially in juveniles. We might use an extra heat source, maybe some heated water bottles or something like that, or a heated water blanket, just to make sure we keep the body temperature up. But I think as long as we use some towels with this bucket.
But with the little packet.
Yeah, right.
Yeah, okay.
So we might need some more. There's quite a bit of pneumonia going through. It's got ketamine and acepromazine together as an injectable anesthetic. Weighs 5.5 pounds, so I'm going to give him about 1/10 of an ml per pound plus a little bit more. Or give her, I should say. That's the other thing you got to check too when you're doing a spay, especially in cats, because it can be hard to tell between males and females, and you open up a cat for a spay and you can't find the uterus, and then you get looking around and then you see he's got
And you
some
go on
balls.
the rear end?
Yep, we're going to go on the rear.
Okay.
The last shot we gave here, so let's go on the other side. The other shot. Scruff there.
You're tensing up, kitty.
Yep. You'll be comfortable after this.
No, now don't hit me.
This stuff burns a little bit. Okay.
Okay. You've about had enough today already, haven't you?
You about had enough.
That's it. That's it now. Don't freaking bite me. You start seeing pink mice.
Oh, good, we got some more paper towels here.
Yeah, I've seen that already.
Usually takes about 5 minutes and then I'll start getting goofy.
So essentially for doing this surgery, do you just handle everything on your own?
For the most part. Sometimes I might need a hand with something. But for the most part, I do everything on my own. Certain animals, especially like if we get in there and they're pregnant, let you relax a little bit more. Relax really good. What I'm doing now, I'm putting in some eye lube. That's usually standard procedure before a surgery, because they're not blinking normally anymore, and their eyes can dry out. They could get ulcers and things.
So their eyes will stay open during the surgery, you think?
They usually stay partially open, yeah. Okay, then we layer in the V tray. Position her. Then I'll tie her legs down. Make sure we get a female. And we do. That happens to a lot of people. It hasn't happened to me yet, but I'm sure it will someday, where you get in there and think, oh my God, has she been spayed before? And you get to looking.
Now you hear about humans having both male and female parts. Does that also happen in cats, dogs?
It can. I've never seen it, but I'm sure it can.
What's the purpose of tying them down?
Just to make sure that they stay really stationary, because when we're doing surgery and manipulating things and stuff, they can, things will have a tendency to move around. I want to make sure she's pretty straight. There we go. So we tie all 4 legs down. And there's always a chance that she'll start waking up early too, and so it's good to have them tied down so that they don't jump off the table. Okay. got her in position, I think, pretty good. Tighten these up just a notch. And then we gotta clip some hair. Clip right along midline of the abdomen. Then some veterinarians clip more than others. I like to clip quite a bit because just in case there's some bleeding in there that you have to go hunting for to stop it. I like to clip the whole abdomen right from the pelvis right up to the sternum. An incision right on midline. Usually go like halfway in between this area here where the umbilical cord was attached and where you can feel the beginning of the pelvic bone. Usually I go a little bit farther cranial towards the head, somewhere right in here. Depending on where you go, some people wear caps and masks and gowns. We don't wear gowns, but I always usually wear a cap and mask, and of course sterile surgical gloves, which are these here. They're sterilized. First we'll take care of the kitty. So we got the kitty laid out like we want her to, and we got her clipped and all the hair away, and then we start scrubbing the surgical area. We usually do at least 3. We usually do at least 3 scrubs, alternating with either like a betadine or iodine solution. Or you can use Novosan, that's another common scrub, and then alternating with alcohol. And we usually start right on our incision and scrub right over the incision, and then work our way out in concentric circles so that we don't bring any contamination in towards the surgery site. And then I kind of moisten down the hair around too, so that we don't have any hair coming up in our incision. Rid of some of that extra betadine. Usually I spray them down with a little Novosan just to keep her moist. And I'll kind of place it like this. So I'll be standing over on that side, on the right side, for the surgery. And I open this up. This is all sterilized. It's in an autoclave. Sterilized under steam and pressure. So I try and just touch the outsides of that, try not get any contamination on the instruments, and then I drop in everything that I'll need. Sometimes I need more stuff, so then I have to yell for Karla or Maxine. I just dropped on some suture, scalpel blade, and then a sterile drape to put over the cat while we're doing surgery. And then I got that all in place, and I go ahead and scrub up my hands a little bit. And I put on the surgical gloves, trying not to touch the outside of the glove if I can help it. And that's the whole principle behind all of this, is to try and stay as sterile as we can. It's not 100%, or it's not the best of conditions, but so far, knock on wood, I've never had any secondary complications from infection or anything like that. So then I fold out my surgical drape, and we're going to cut a hole in it. If I can find a scissor. A hole about the size of our incision, maybe a little bit bigger. I kind of have a general idea where that incision is going to be. So I lay that down about over the right position. Kind of adjust that, and then we clamp that in with some towel clamps so it doesn't move. Okay. Could you do me a favor and just for doing surgery, scalpel handle with a number 15 blade. It's just a small straight blade for making our skin incision and for incising the horns. Needle holders, which we'll use to hold my suture to make sutures to close up the wounds. And then we have a series of clamps that we'll use to clamp off blood vessels and things. And tissue forceps. And the other important thing to make sure we have is, this is called the Spay hook. This is the loop that we use to fish out the horns.
Horns being? The
uterine horns. The uterus basically consists of a body and then two horns that go out to the ovaries.
Mm-hmm.
And we'll get a picture of that once we get in here. One other thing I need to grab. Done midline. And let's see, the pelvic bone is there, the umbilical cord is there. I'm going to try and go a little bit cranial, going through the skin. I try and make deliberate skin incision. You don't want to try and, pick it up and nick through it. You want to make as nice and smooth an incision as you can through the skin. So now we're through the skin. We got fat there. We got a little bit of bleeding, some minor vessels. That's no big deal. Then we're down to the body wall, in between some muscles. I'm going to try and pick that up if I can. Might need to make a little incision there. A little nick in there, and then we're going to try and make a stab incision in through the body wall. The whole objective is here to be controlled. We don't want to go all the way through the body wall and hit an intestine or something like that, that wouldn't be good. So now we're through the body wall. Try and make as small of an incision as we can. We might need to make this a little bit bigger. We got a bunch of fat to contend with and things. What do I do with my spay hook? Where did I set that? Oh, here we go. So we got the body wall open, we got that. There's always fat to contend with. Abdominal fat. And then we use this hook, and then we just start fishing. Try and find the uterine horns, and sometimes they can be difficult to find. Because, one, they could be in a bunch of fat, or two, there's intestines there. And you want to make sure you don't get any, get too many intestines out. We've got our first horn out here. I'll stick this underneath. It's really small. It's even smaller than the size of a pencil. So this means this is basically a prepubescent or a juvenile tract. If she had had at least one heat cycle, that would be a lot bigger than that by now. So this is one uterine horn, and then we have, I don't know if you can see there, right at the end of the horn is the little ovary, very small, right there. And our objective here, we want to exteriorize that ovary, and we got it pretty good. Usually I break down, there's an ovarian ligament that holds it to the body wall. I try and break that down with my fingers if I can. To exteriorize that. And what we're trying to do here is to bring it out far enough so that we can ligate that ovarian artery right there. That's our whole objective, because we don't want that to bleed. So I get that out a pretty good distance out of the body. And then I put a clamp on it. Clamp is to help control the bleeding and also to make sure it stays out of the body while I put some suture around it to shut off the blood supply. So I got my horn out. This is where it's handy to have an extra hand, but you can get by without. I bring the suture around underneath the clamp, because we're essentially going to be putting that suture right where the clamp is now. And the suture is going to stay in there. The suture is there to control bleeding, and that will dissolve over time. It's the type of suture I'm using is called catgut, which is appropriate, I guess, for a cat. Put a few knots in there and cut it off. Okay, so I got the horn. Want to make sure we get the horn and all the ovary. Push some of that fat back in. Want to get horn and all the ovary. We don't want to leave any ovary in there. And then I got the ligature down below. Now this is the moment of truth. We cut right next to the clamp to release that ovary, and then we usually put another clamp on that ovary and uterine horn, just like that. And then we have to check. We're going to release that. We're going to release that ovarian pedicle, and then we're going to check to make sure it's not bleeding. Which can be kind of tough sometimes. Usually grab onto it, hang on to the side, kind of hold it for a moment or two and see if any blood swells up. And it looks like it's going to be fine, so I'm just going to let it go. So we got one horn up here. I'm going to move this clamp a little bit. Now I got to try and find the other horn. Sometimes that can be difficult, for me anyway. So we got to go fishing again for the horn on the other side. Again, there's a uterine body with two horns, and each horn traveling to the ovary on either side. The ovaries kind of sit up by the kidneys, pretty close to the kidneys, anyways. Here's our other uterine horn, and you want to follow that down all the way till you find the ovary. There's the other ovary right there. Definitely want to make sure that you don't have intestine in there or anything else that's important. So again, we want to grab on by the ovary, break down the ovarian ligament. There's a ligament again that holds the ovary up towards the body wall. Just kind of gently pluck at that and break it down so that we get the ovary out as far as we can so that it's easy to ligate. And we want to make sure we don't bust that blood vessel right there, the ovarian artery, because that ovarian artery is attached or enters directly in to the aorta. And in young animals like this, I mean, it's not as big of a deal when I shouldn't say it's not a big deal if they start leaking. It is, but it's a smaller opening with such a juvenile tract that they're not likely to bleed to death before you can get it stopped. And things do happen like that. I mean, these ligatures can fall off, and you'll know it before you close, because you'll see blood pooling up in the incision. I'm telling you all this, and you're thinking, God, I'm never going to want to do this to a pet again. But I'm just telling you like it is, and that's why we make sure that we follow basic principles, go step by step, and then double check everything. Move this clamp a little bit. Ligature tight. And then when I'm suturing this, I'm doing basically four knots, which makes 2 square knots. That's a standard surgical tie. Do one more on there. cut it off kind of short. And again, that cat gut will dissolve. Let's see, need another clamp. That's a big one, but it'll work. Then I cut away again above the clamp here. Let that horn go back like that. And then we got to check to make sure we got this bleeding stopped on this one. Gonna hold it for a few seconds. I think we're okay. Good. So we got 2 uterine horns, and depending on who you talk to, some people do it differently. Some people will go down to the body. There's a body, and it kind of makes a Y into 2 uterine horns. Usually on cats, I just remove most of the horn, and as long as we make sure we get all the ovary out, that will, whatever is remaining in there will shrink down, and we won't have any problems with infections or things like that. Because that's the other main thing we're concerned about is infection. And on these small cat tracks, I just put 1 ligature, or basically 1 stitch or suture on everything. If it was a bigger tract, I'd probably put 2 for safety's sake, but 1 usually does it here. And I usually don't put another clamp on. You can put another clamp down on the horn where I put that ligature, but I don't think it's going to bleed very much. Check for bleeding. I think that's going to be fine. Okay, we'll do the other horn. This suture's almost a little too big for this cat, but this suture material comes in all different sizes. I think this is 1/0. It's 1/0, which is relatively small, but might be a little too big for this cat. I'm trying and make most of my incisions, or most of my cuts with the scalpel if I can. You probably want to see what the tract looks like, what I've taken out. Here's 1 uterine horn with the ovary up there. There's the other one. They're about a little over 1 inch long. It's pretty small. Cool, that looks good. Check again for any pooling of blood. Everything looks good, so we're gonna close. In cats, I do what's called a 2-layer closure. I close the body wall, and then I do 1 layer to close the skin. You can do what's called a 3-layer closure, where you do, besides the skin itself, you kind of do 1 layer to kind of bring some of this subcutaneous or tissue under the skin together. But I found that cats react more to a lot of suture, so I try and use as little as I can. because this is, it's they kind of react like when you have a splinter in your finger. It's a foreign body that they want to try and get out of their body, and they're trying to fight it. A little suture doesn't seem to bother, but when you use a whole lot, they kind of come on here. They kind of don't like it. Trying to find the end of my suture to cut it off. I'm doing a basic suture pattern called a simple interrupted. I'm just doing one throw at a time through the body wall to close it. There's all kinds of suture patterns. This is a very basic one. It's basic and it works the best to close. Just in case, one of these might break open, it won't affect the rest of the sutures that are in there. Cut them off pretty short. And this again is another type of suture called PDS. Very good suture for closing things, doing anything inside the body. It's what's called an absorbable suture, because over time the body will reabsorb it, or it won't react to it anyways. The other type of suture which we'll use in the skin is called non-absorbable. That's the basic categories. And non-absorbable is ones that won't dissolve over time very easily, but they're really good for closing up skin wounds and things. Again, I want to make sure I'm grabbing just body wall and nothing else. There's a lot of internal fat and stuff that wants to stick up. I'm throwing when I'm going through the skin, I get a little knot here to get rid of. Or not the skin, but I'm going through the body wall. I'm going through different types of tissue. I'm going through muscle and connective tissue called the external rectus sheath, which you might think muscle as being strong as far as holding stitches, but it really isn't. You want to get that connective tissue, that external rectus sheath. You want to make sure you get that in all your incisions, or in all your sutures, because that's where you're going to have your strength. One more here, and we'll have the body wall closed. goes in the body wall. Now I gotta get some, if you'll excuse me. We're just using, this is called chlorophyll. I like it because it's pink. But you can use all kinds of absorbable suture. Oh, that'll work. That's the one thing about buying a suture that's not a needle. My eyesight is hard to get. Okay. Now I'm going to do a skin closure. I'm going full thickness bites through the skin. Using what's called a cutting needle. It's got a sharp edge on it, so it cuts through the skin pretty easy. Skin is kind of difficult to put stitches in. And on skin you can do all kinds of suture patterns too. I'm doing what's called a cruciate, which is kind of an X pattern, but you can do all kinds of suture patterns in the skin too. Just so it kind of brings it together. I don't want to pull these too tight because the skin's you got to allow the skin to kind of move a little bit. There's going to be a little bit of swelling. You don't want those stitches so tight that you're going to cut off blood supply. Sometimes if I'm putting in really long, if I've got a really long incision to close, I'll go deep and kind of pick up on some deeper tissues to kind of help close everything deeper. That's another principle that you want to follow when you're doing surgery too. Oops, I pulled through that one side. You want to eliminate what's called dead space. You don't want to leave a big pocket in there, because that's a good place to start an infection. Do I sound like Mr. Rogers when I'm doing this?
No.
Don't want to be too monotone. Might put one more just to simple in there. These again are non-absorbable sutures, which means that they will not dissolve. They'll have to be taken out in about a week or 10 days. Good things to tell the owner in between there is to watch the incision site. for any signs of infection. If we follow good procedure and good techniques, it's usually never a problem. But signs of infection would be redness, swelling, any oozing,